Hello and welcome back. So I've got some requests on the email here lately. People want to know how to go about doing their clinical shifts or how to go about doing their first couple of clinical shifts. And this is a staple of the paramedic program. So even though it's not expressly cardiology related, I figured we could go with this. Let's jump right in. Punctuality. Early is on time is late. Remember that through the entirety of your career, it will always help you. Punctuality is the measurement of the importance you place on an event. You wouldn't be late to your own brain surgery. Your FTO understands this concept, and they know if you're a go-getter, if you're going to jump in there, you're going to get there early. Also remember, all agencies consider personnel for employment the first day they show up as a student. You are getting a chance to put your best foot forward before you ever set foot in a job interview. More people are hired on the basis of how they performed as a student than are by other means in many places. And you really need to remember that. Also remember that the basis of all shift work begins with punctuality. If you're 1 minute late, the person you relieve may have to run and chart a cardiac arrest. That is not going to win you any friends. Also, you might make them late for a second job. Many of us have to have 2 or 3 jobs to make ends meet in this field. It's important that you get there on time or a little early. The uniform. This may be your first uniform job. We absolutely understand that, and we absolutely don't care. You're not going to get any leeway on your uniform. FTOs like me reach out to agencies and we ask what their uniform standards are. Your appearance, the pride you take in your appearance directly relates to the pride you take in your work, and we can judge that very quickly. It lets us know if you're going to be a good fit for the community in which you're trying to ingratiate yourself. Whatever the uniform is, wear it correctly. Your FTO usually knows how your uniform is supposed to be worn. We often don't say anything unless it's just egregious. But we are making note, and when your application comes in on the pile, that's one of the things we're going to remember. Okay? This should not be a problem, but it is. Hygiene. Wash yourself before a clinical shift, and I don't mean a month before. We're going to be doing work in a 6x8 box where it's going to be 100 degrees if it's a trauma patient or we're delivering a baby. I shouldn't smell you, and you shouldn't smell me. Don't wear overly powerful colognes and things either. You're going to be treating asthmatic patients and patients with emphysema. This is going to exacerbate their symptoms and make them harder to treat. Also, general notes, groom yourself. If you are a clean-shaven person, shave before your shift. If you have facial hair, groom it correctly. Fingernails. Do not have long fingernails in the medical field, period, ever. They're just a place for bacteria to grow. Don't ever wear fake nails in any capacity in the medical field either. You're just begging for an infection. Hair color. Make sure your hair color is appropriate for where you're working. All right. In some places, it's totally acceptable to have several different hair colors, artificially put in. In some places, it's not. Just make sure that you are coming in and fitting into the environment that you're going to be in for that clinical shift. Eyelashes, more specifically fake eyelashes. Don't wear them. They're going to come off at the most inopportune time. You're going to stick a bloody finger in your eye trying to fix them. It's just a bad idea. You're coming to work, not to impress anyone with aesthetic qualities. Makeup. Wear your makeup how you choose and within whatever regulations are put forth to you, but make sure it's waterproof. This is a tip I know a lot of people wish they had before their first clinical shift. There's every chance you're going to be working a wreck in the rain. Make sure it's not something that's going to run. It's just going to give you a hard time. And then jewelry. Be conservative with your jewelry. A thick chain around your neck is a perfect thing for a psychiatric patient to grab you and to have you buy. This is the kind of stuff you need to consider. So moving forward, work ethic. Be a go-getter, especially when you don't have to. As an FTO, I know you don't have to help me wash the truck. I know you don't have to help check it off, and I know you don't have to clean the station, okay? When you jump in and do those things, even though you don't have to, you're doing a lot to ingratiate yourself in a pretty tightly knit community. You're also doing a great service to yourself in terms of getting a job. These things are imperative to the person that wants to come into the EMS community. We're a tight community and we're not going to roll out the red carpet. You will have to ingratiate yourself. It's very much like a football team for any of you guys who have ever played football. Also, offer to help cook. If you're in the station and they're cooking for the whole firehouse or whatever, get in there, jump in there and be part of the group. It will be appreciated. You're not going to be shunned. When you're not busy, when you have nothing to do, study your book, study other lecture plans and things like that. Make sure that they see how dedicated you are to learning this craft. Most of all, ask questions and have discussions with your FTO. If you're writing with an FTO, it's because they have something to lend to the learning process, and the agency wants you to get the most out of it. You're not just trying to put your best foot forward to the agency. The agency's trying to put their best foot forward to you. There's been a shortage of paramedics since 1973. They want to make sure that if you're a good student, they have the chance to recruit you and have you work for them, okay? You don't have to be a medical wizard to do any of this, and it costs $0 to be proactive and jump in there and help. Medical knowledge. All right, this one's touchy. We get rusty, and I know any FTO hates to hear another one say that, but we get rusty. It happens. Don't overcorrect a preceptor. Don't try to establish dominance through the basis of knowledge. Remember that your education is a snapshot of the medical world. There's a lot of things these guys have seen that may appear unorthodox, but once you learn the method behind the madness, it makes a lot of sense. Your preceptor often knows things you don't. They often know that certain mechanisms of injury, certain natures of illness lend themselves to different types of scenarios that aren't textbook treatable with the simple, drug and disease solutions you may have learned. Ask why they do things a certain way. Don't preface it with a book answer to try to show off your knowledge. It's generally rare you're going to be able to impress a field training officer. They've been doing it over a decade in most cases. And I included an example here. You can pause the video and read it. The top section is how I wish the conversation had gone. The bottom one is how it actually went, and that was a problem. The next one is the bat belt. Please don't show up with the bat belt on like Bruce Wayne with all kinds of gadgets. Don't show up overly laden with equipment. And I know it shows your enthusiasm. I know you're ready to get in there and do some stuff, but it immediately creates a poor perception of you. Carry the equipment you need. Some good stuff you can find on the left. Stethoscopes, scissors, and don't bring in $80 pair of scissors to clinicals. If you want a pair of scissors, let me know. I'll get you one out of the supply room. They cost us like $1 a pair. Pocket knife is always useful. Bring some pens, notebook, cheat cards. Paramedics on duty wear cheat cards. Nobody's going to make fun of you for wearing a STEMI cheat card or a stroke exam cheat card. Bring a bag for the ambulance with water and snacks. You may not get a hot meal that day. What you eat that day may be what you bring. Things not to carry. Don't carry a bunch of cumbersome stuff. Don't bring your own traction splints and flashlights from the 1980s that hold 18D batteries. They're going to get in your way and mine, and they serve no practical purpose. Don't bring your own pager from your fire department to clinicals either. That's a huge one. There's nothing I hate more than hearing a pager go off at 3 a.m, jumping up, throwing my boots on, only to hear the intern say, "Oh, that was my pager from home, guys, don't worry." Pagers trigger anxiety in EMS crews when they're on duty. Don't bring your pager from home. And also, don't bring anything you don't know how to use. Don't bring some kind of new special gadget, whatever it may be, and you don't know how to use it. Don't do that. It'll create a poor perception of you. The last thing is get in there. Take the vital signs. Check the blood sugar. Put the electrodes on. Run the EKG. Get in the cabinet. Start handing stuff out. Spike the bag. Ask to start the IV. Nobody's going to hand any of this to you on a silver platter. Now, don't diagnose and treat without the help of your FTO, because that's what they're there for. But show that you're not afraid to get in there and do a physical exam and palpate the abdomen and put, flexion on the pelvis and elicit a Babinski's reflex and all these things that are important. Get in there and be a part of the group. Your FTO is going to appreciate that, and they're going to have a lot more respect for you. They're going to make you earn it, but these are easy shortcuts in how to do that. And with that, that's all I've got, guys. Thanks for watching.